Hello, my name is Dan Shankit. I'm the coach of the hospital pharmacy here at Monroe Clinic. The purpose of this presentation today is to make sure that you understand your role in the safe medication use process here at Monroe Clinic. By the end of this presentation, you should be able to do the following. Describe the interdisciplinary medication management system, recognize and distinguish between a medication error and an adverse drug reaction, explain what the term culture of safety means, explain the role that a voluntary error reporting system plays in our medication safety process, understand how to report a medication error here at Monroe Clinic, and also list some ways in which you can minimize medication errors in your role. There are a few important definitions that will help you understand the rest of this presentation. The first is adverse drug event, or ADE. An adverse drug event refers to any injury or harm caused by the use or misuse of a medication. It's a category term, meaning an adverse drug reaction or medication error is included within adverse drug events. It's a composite of the other two. An adverse drug reaction, or ADR, results when there is the appropriate use of a medication, meaning the right medication is given to the correct patient, but there is an unexpected response to that medication, whether it be an extreme or rare side effect or other type of reaction. The key thing with an adverse drug reaction is that an error or mistake did not occur. On the other hand, with a medication error, there is some type of mistake that has been made in the administration of that medication to that patient. In other words, it's a preventable event that could lead to inappropriate medication use or patient harm. Medication error also includes near misses and good catches. A near miss or good catch occurs when a mistake is made, but the mistake is caught and fixed before the patient receives the incorrect medication. These are all important types of events that we want to look at to make our medication use process safer. At this point in the presentation, you may be wondering, why do we need to talk about this? In today's high-tech world, we have so much technology and people are so smart. Why do medication errors ever occur? Well, the numbers suggest that medication errors are still occurring and that there is still room for improvement in our medication use process. As you can see on this slide, there are still 2.3 to 6.7 adverse drug events that occur per every 100 admissions. In other words, 1 out of every 20 patients admitted to the hospital will have some type of adverse drug event, whether it be an extreme reaction or a medication error that is made. The same is true on the ambulatory or clinic side as well. There are still medication errors that occur there, so clearly there's still room to make improvements in our medication use process. In order for you to truly understand our safe medication use process here at Monroe Clinic and how we got there, it's important to have a little bit of historical context. In previous eras, we used to think of an error as an individual person making a mistake or individual person failing. Literature, though, has suggested that we can be more effective if we think of medication errors being a result of a system failing, meaning our medication use system, so the process that we use to help patients get the right medications, can sometimes fail or have breakdowns. And if we think of medication errors as a system failure, we're able to make changes to that system to help prevent those errors from occurring in the future. Let's look at that a little more closely. There are some problems with thinking of a mistake being made as an individual failing instead of a system failing. For example, if we look at it as an individual failing, we're not really going to identify the true cause of the medication error. There may have been other factors in that patient's or in that person's environment that contributed to the error being made. And if we don't address those real causes, we're not going to be able to make our medication use process safer. Another concern with thinking of it as an individual failing is that staff may feel punished, or they may be punished, if they make a mistake that leads to patient harm. That may lead staff to hiding errors or hiding mistakes that are made, and the staff become the victims because they are working in an environment where the medication use system cannot be changed or will not be changed because people are hiding errors, so they're never brought to the light to really be investigated so that we can change the system. In other words, we don't really learn from the mistakes that are made because we're not able to fully capture what it is that happened or what it is that contributed to the error being made in the first place. So clearly focusing on an error being an individual failing is not a good approach to take, and it's not an approach that we take here at Monroe Clinic. Here at Monroe Clinic, we think of medication errors as being a system failure. By doing so, It allows us to identify what the problems in the medication use system are so that we can fix them to prevent future errors from occurring. In other words, we can identify what environmental factors or workflow factors contributed to the error happening in the first place and correct those to prevent future mistakes. We also take a non-punitive approach to following up on medication errors. What this means is that staff are not punished for making mistakes. Now, on the other hand, if someone makes a conscious decision to cause patient harm and do something outside of regular policies and procedures, clearly we need to follow up with that person about their behavior and correct that so that does not happen again in the future. But with simple mistakes or medication errors that are made, we focus more on the system than we do on the individual person. This has allowed us to encourage the reporting of errors so that we can learn more from those error reports. There are no individual victims, meaning staff do not feel victims of the medication use system, and it supports an active learning culture and helps us improve our processes to prevent medication errors from occurring in the future. The reason we are willing to focus on medication system errors instead of focusing on individual person errors is because we know that the people we hire here at Monroe Clinic are good people that do not want to make mistakes. By going through the application process and being hired here at Monroe Clinic, we know that we want you to be on our team, and we know that you are smart enough and capable of treating our patients correctly. As you can see in this quote here, a very well-known physician at the Harvard School of Public Health said that incompetent people are at most 1% of the problem. The other 99% are good people trying to do a good job who make very simple mistakes, and it's the processes in place that set them up to make these mistakes. That's why we focus on fixing the medication use system instead of correcting individual employee behavior. Medication errors continue to occur throughout healthcare because the medication use system is very complex. In order for a patient to receive the appropriate medication, a provider must make an accurate diagnosis and determine which medications to treat the patient with. This requires them to know which drug to use, what dose to use, and what directions to give the patient on how to take it. They then send the prescription to a pharmacy who dispenses the medication. In order to dispense the medication appropriately, the pharmacy must ensure that the right medication is dispensed to the correct patient. There are the right pills in the bottle, and the right directions are on the bottle too. And they also need to educate the patient on how to take the medication safely. On the inpatient side, medications are administered to patients, and a nurse or other provider must ensure that the right medication is being given to the right patient at the right time, right dose, right route, and the right monitoring is in place to make sure that the patient does not have any adverse effects from this medication. They also must document which medications are given because this can impact future medication decisions. In other words, it's helpful to know which medications you've already received so that we can change your therapy in the future if we need to. The complexity of this medication use system requires all people involved in it to know about medications, at least at some level. People also need to understand the medication use process and what their role in that process is, and also maintain vigilance to help prevent medication errors from slipping through the cracks. This is probably the most important slide in the entire presentation, and I'm not saying that because Monroe is well known for its cheese. The Swiss cheese model represents our medication use system and the safety steps that are in place to prevent medication errors. Each piece of cheese represents one safety step. The red line is a medication error that has occurred. If the medication error, or red arrow, is able to make it through each piece of cheese or safety step, the error will reach the patient and a bad outcome could occur for that patient. We can use this model to think of medication errors in our safety system in a couple of different ways. If we look at the top of each piece of cheese, there is a person listed there. Each person could be thought of as a piece of cheese. A provider must make sure that the right medication is ordered. A pharmacist then double checks to make sure that that medication is appropriate for the patient and also that the right medication is dispensed. The nurse then administers the medication or instructs the patient on how to take the medication at home, and the patient then takes the medication themselves. If we look at the bottom of each piece of cheese, there are some different technologies that we use to help prevent medication errors too. The first piece there is the electronic health record. Our electronic health record has many safety alerts built into it to notify providers if the dose they prescribed is too high or inappropriate for that patient. We also use barcode scanning on the inpatient side to make sure that the right medication is ordered for the patient and that the right medication has been dispensed and will be administered to the patient. For IV medications, we also use smart pumps. Smart pumps allow us to make sure that IV medications are administered at the correct rate to each patient. The patient, though, is probably the most important safety step in this medication use system. Educating our patients about their medications so that they know what to expect can be a great last check to help prevent medication errors from reaching them. The medical literature is full of papers describing the components of a safety culture and also identifying things that organizations can focus on to make sure that their organizational culture supports safe medication use. As you can see from the pyramid on this slide, the base of a safe medication culture is reporting. Without reporting medication errors, we are unable to learn from the errors that have occurred in order to prevent future errors from occurring. There are a number of reasons why medication errors are not reported. The most common ones are people are afraid of retribution. They're afraid of punishment for errors that they have made. Sometimes people are concerned that the medication error reporting process is too cumbersome or time-consuming. Sometimes people feel that nothing happens if they submit a medication error report, so why take the time to do it? Others are concerned that the error report is not confidential and that others may learn of the mistake that was made, or learn who made the mistake. And sometimes, and maybe worst of all, sometimes people aren't even aware that an error occurred. This might pose the biggest risk to our patients. Therefore, a successful reporting system is non-punitive, meaning people are not punished after reporting an error. The reporting system also provides confidentiality. It's also independent. This means that even if you are not involved in a medication error directly, but you're aware of it, you can still independently report that the error occurred. It also means that the error is reviewed independently by experts in medication safety. The reports also need to be followed up on in a timely manner so that the medication safety can be fixed to prevent future medication errors. As we talked about earlier, the focus also needs to be on fixing the system and not on correcting individual behavior. The system also needs to be responsive, meaning we can adapt as we go along in order to make our medication use safer. Every year, Monroe Clinic's patient care employees are asked to fill out a survey that will help leaders understand the current culture of medication safety at Monroe Clinic. In part of the survey, staff are asked to state whether they agree or disagree with the following statement. Staff feel free to question the actions or decisions of those with more authority. As you can see, from 2006 to 2012, the percentage of employees who were comfortable questioning those with more authority steadily decreased. This was certainly concerning for medication leaders at Monroe Clinic, including the Safe Medication Task Force. As a result, the phrase, "I need clarification," was coined as a way to bring everyone's attention to a potentially unsafe situation. You will now watch a video that describes the use of this phrase, "I need clarification." Here at Monroe Clinic, we are helping improve patient safety in the following ways. We are helping support a non-punitive culture. We are also working to promote increasing medication error reporting and focusing on communicating different things that we can all do to prevent medication errors from occurring in the future. We've also focused on reanalyzing medication errors that have occurred and trying to identify system trends so that we can fix the system to prevent future errors. We're also trying to identify if there are any new or existing technologies that we can apply to help prevent medication errors, and then we also do quite a bit of safety education about how to prevent errors from reaching our patients. If you identify that a medication error has occurred, it's your responsibility as a Monroe Clinic healthcare provider to report that incident, even if you were not involved with the error or did not contribute to the error yourself. It is your responsibility as a Monroe Clinic healthcare provider to make sure that all medication errors that occur that you are aware of get reported through the medication error reporting system at Monroe Clinic. You can access this error reporting system from the homepage of the Monroe Clinic intranet. On the left-hand side of the homepage, you will find a link that says Report an Incident. Click on that link. On the next page, you will be presented with a number of different types of events that can be reported through the Verge reporting system. Click on the icon that looks like a pill to report a medication error. On the Verge Error Reporting homepage, you will be asked to log into the reporting system using your Monroe Clinic email address. This email address is not used as a way to follow up with you after the error has occurred. Rather, it identifies that you are a Monroe Clinic employee. After logging into the medication error reporting system, you will be asked to provide as much information about the error as you can. Remember, you also want to report near misses using this system as well, and we'll get to that in a little bit. The first thing you want to fill in the error report is the date of the event. So when did the error occur? Ideally, the report is filled out the same day that the event occurred. However, we understand that sometimes patient care demands necessitate filling out the report later. Try to fill it out as soon as you can. Next, you are asked to fill out where the event occurred. By clicking the Select Location link, you can choose all of the departments within Monroe Clinic, including inpatient and outpatient departments. In the next section, you are asked to fill in person information. Be careful with this section. This is not asking for your personal information. Again, we try to keep this system as confidential as possible. You can provide your name in the comments box at the bottom if you want to be followed up with, but it is not necessary. In the person information box, you are asked to fill out information about the patient, including last name, first name, middle name, date of birth, gender, medical record number, and the time that the event occurred. This allows us to follow up with that patient's chart to determine why the error occurred. The next section asks you to identify what type of person the error occurred for. Was it an inpatient, outpatient, visitor or family member, etc.? The asterisk next to the next question indicates that it is a required question. This question is required because it will change the future questions that are asked at the bottom of the survey. Here is where you designate whether an incident occurred, meaning the medication safety event reached the patient, whether or not they experienced harm from that error, or did a near miss happen where an error occurred but we identified it before it reached the patient. You can also use this question to indicate that you are just reporting an unsafe condition so that we can follow up on those in the future to prevent medication errors. For the sake of this presentation, let's assume that an incident occurred. Click on the Incident button. As you'll see, the questions on the rest of the survey will change. 2 questions later, you are asked to describe what type of medication error occurred. Was it a documentation error, meaning the wrong thing was documented in the patient's chart? It was the wrong patient, wrong medication, wrong dose, wrong route of administration. The medication was given at the wrong time or at the wrong rate, or the duration of therapy was too long. Was it the wrong dosage form, meaning an extended release tablet was given instead of an immediate release tablet? Was the wrong strength or concentration of product used? Was it prepared incorrectly? Was it expired? Was it known to be an allergen to the patient, meaning were they allergic to the medication but it was given anyway? Or is there some other contraindication or reason that the patient should not have received the medication? Omission means that something was forgotten, meaning you forgot to give a medication that should have been given or forgot to do a procedure for the patient. In the other box, you can document any other type of medication error that may have occurred. The next question asks you to determine at which stage in the medication use process did the medication error occur. This helps the people that analyze the medication error reports to determine where to focus our medication safety initiatives. Did the error occur in the prescribing phase, the dispensing phase, the administering phase, etc.? Again, you can choose other if none of these phases make sense to you. The next question is perhaps one of the most difficult questions to fill out on this survey, but with a little practice it gets much easier. Here you are asked to identify which medication was actually involved in the medication error. Click on the Select Medication link. When the next page comes up, you will be asked to type in the medication. You can search by National Drug Code or NDC number, if you know that. You can search by medication name, manufacturer, dosage, route, etc. What's tricky about this step is that every medication product that's ever been made by every manufacturer shows up in this report. If you search for sodium chloride, for example, you are presented with thousands of entries for sodium chloride. That's because many medications contain sodium chloride. My advice is to get as close to the medication involved in the incident as you can. Even if you know it's not exactly right, but you can't figure out how to get the exact right medication in there, just get as close as you can. And then in the comments box at the bottom of the survey, type in which medication was actually involved in the incident. We don't want the system to be so cumbersome that it prevents you from reporting an error. In the next section, you are asked to provide any more medication information that you can. For example, if you know the manufacturer of the medication that was given, if you know the lot number or the strength, etc., please fill that in. You are then asked to identify if a second drug was implicated in the medication error. For example, maybe two drugs were confused and the wrong medication was given. This is where you'd want to list the second medication involved in the incident using the same process that we identified for the first drug. In the next section, you are asked to identify what the patient's age was at the time of the event. Were they a child, an adult, an older adult, etc.? Again, if you don't know, just click Unknown. Next, you are asked to identify if any intervention was attempted in order to rescue the patient from the medication error. For example, perhaps they needed to be transferred to another hospital that could provide more critical care as a result of the medication error. Maybe there's an antidote available that can be used to reverse the effects of the medication, etc. Again, you can click Other and type in whatever other intervention was attempted if that is the case. Next, you are asked to identify if a medical device or instrument was involved in the incident. This helps us identify if we need to involve our biomedical engineering team to help redesign some of the equipment that could have contributed to a medication error. In the next section, you are asked to grade the severity of the medication error and describe the harm that was caused to the patient. This can range from no harm being caused all the way, unfortunately, to death. Try to get as close as you can with one of the answers provided, or indicate that it's unknown what the extent of the error is at the time of the report. Next, you are asked to identify who was informed that the event occurred. It is very important that the family or patient is informed that the medication error occurred so that they are aware of what's happening with their care. It's also important to identify the physician so that we can identify if there's anything we can do to help reduce the harm caused to the patient. In the next section, you can provide any additional details that you want to about the medication error. Feel free to be as descriptive as possible in this section. The more information, the better, and it allows those that follow up on the error to make sure that we can adjust our medication use system appropriately to prevent the error from occurring in the future. Again, if you want to be followed up with about this medication error, for example, if you want to help try to fix the system, you can certainly list your name and contact information in this box. When you are finished with the error report, click on Next Page. On the next page, you will be asked to review the report and then click Submit. Be sure to click Submit. If you don't, then the error report will not be submitted and we cannot follow up on it to prevent the errors from occurring in the future. Again, this seems like a time-consuming process, but once you submit a few error reports, you realize that it's pretty quick once you get the hang of it. If at any point you're having a hard time filling out the medication error report, talk to your coach if you're comfortable with that. Otherwise, contact the hospital pharmacy or me, Dan Shankett, the coach of the hospital pharmacy, and I can help walk you through how to fill out the error report. So far in this presentation, we've focused a lot on what we can do as an organization to promote safe medication use. Next, let's focus a little bit more on what you individually can do to help prevent medication errors. The most important thing you can do is check what you're doing before you do it, double check it, and if in doubt, check again or ask for help. It's always better to double check in order to be safe than sorry. Don't be afraid to intervene and question the decisions or actions of those with more authority. And also remember to follow all proper procedures that are outlined for your department for how to use medication safely. And remember your role in the Swiss cheese model. Also, always follow the 5 R's: right patient, right drug, right dose, right time, and right route. And don't make assumptions either. Don't assume that just because the pharmacist put the medication in the patient's drawer, that must be the right medication to give to the patient. Pharmacists, as well as providers, nurses, everyone, we all make mistakes. So you never want to assume that something is safe even when you feel it isn't. You also want to know why you are giving a medication, and also inform the patient about why you're giving the medication. That can be one last step to make sure that the right medication is being given. You also want to know what to expect after the medication is given and any other potential side effects to watch for. Again, check and double check. And if you're in doubt, check it out again. We have a couple of important policies that I want to highlight that describe safe medication practices here at Monroe Clinic. The first is our look-alike, sound-alike medication policy. This policy identifies medications that either in writing or when spoken look or sound alike. For example, the most classic look-alike, sound-alike combination is hydroxyzine and hydralazine. When they're written out on a slide like this, it's pretty easy to see that they're different words. But when you see the medication names handwritten or when someone pronounces them, it's really easy to get them confused. The policy here at Monroe Clinic outlines a number of different steps that we take to prevent these medications from being mixed up, including in the pharmacy we store them separate from each other. We do not store them alphabetically because it's too easy to grab hydroxyzine when you meant to grab hydralazine. Make sure you are familiar with this pharmacy policy. We also have a high alert medication policy. This policy identifies medications that, if an error occurs with their administration, can cause significant harm for the patient. For example, if a patient receives 10 times too much heparin, a blood thinner, they could easily bleed to death. Similarly, if a patient receives 10 times too much insulin, they could easily die if their blood sugar drops too low. Familiarize yourself with Monroe Clinic's high alert medication policy. One of the key components to our safe use of these high alert medications is requiring that 2 healthcare providers review the medication before it is administered to the patient. As I've suggested multiple times throughout this presentation, involving the patient in the medication use system can be very effective in preventing medication errors from occurring. It's really important to involve the patient in their patient care and keep them informed about what's happening. Anytime you give them a medication on the inpatient side or give them a prescription for a medication on the outpatient side, you want to make sure they understand the purpose of the medication, what the name of the medication is, what the dose is, and how to take it. It's also important to provide written instructions that are easy for patients to understand, even patients that have low literacy levels. The reason written information is so important is because we often bombard patients with way too much information while they are here in our presence just because we don't have very much time with them. You also want to pay particular attention to problematic drugs that can cause patient harm. For example, blood thinners. It's really important to educate patients that they need to watch for any signs of bleeding and report them immediately if they do occur. Involving the patient in the safe medication use process helps ensure that medication errors do not occur. The Safe Medication Task Force has developed a couple of interesting videos that will help you understand the medication use process and some safety features we've built in here at Monroe Clinic. The first one being the "I need clarification" phrase, and the second one focusing on why it's important to report near misses as well as medication errors that reach the patient. Please click on the links on this slide to watch these 2 videos. That concludes our presentation on medication safety. If you ever have any questions about the medication use process in your area, please talk to your coach. If you have any questions that your coach cannot answer or you have concerns about the medication use processes throughout the organization, please feel free to give me a call. Again, my name is Dan Schenkett. I'm the coach of the hospital pharmacy here at Monroe Clinic. Thank you.